Let me ask you something. When was the last time you went to the bathroom and felt completely satisfied afterward? Not rushing in, not standing there waiting, not finishing, and then immediately feeling like you need to go again. Just a clean, strong, complete trip to the bathroom. If you had to think about that for a moment, this video is for you. I'm Dr. Abigail Brooks, a urologist with over 2 decades of clinical experience. I've worked with thousands of men in their 40s, 50s, 60s, and beyond. And one of the most common complaints I hear in my office is this: "Doctor, something's off with my bladder. I wake up 3 times a night. My stream is weak. I feel like I never fully empty." And what I tell every single one of those men is the same thing I'm going to tell you today. This is not something you just have to live with. And in many cases, relief is far simpler than you'd expect. Today, I want to talk about an enlarged prostate, what it actually is, why it happens, and specifically one 30-second habit that I recommend to my patients that can meaningfully improve urine flow naturally. No surgery, no prescription required. Just a simple, evidence-informed practice that most men have never heard of. And once you understand why it works, you'll want to start today. So let's get into it. The prostate is a small gland, roughly the size of a walnut, that sits just below the bladder and wraps around the urethra, the tube that carries urine out of your body. Its primary job is reproductive. It produces fluid that nourishes and protects sperm. But here's what most people don't realize. Starting around age 40, the prostate naturally begins to grow. It's a process called benign prostatic hyperplasia, or BPH, and it is extraordinarily common. By age 60, more than half of all men have some degree of it. By age 80, that number climbs to nearly 90%. Now, benign means it's not cancer. I want to be very clear about that. BPH is not prostate cancer. They are separate conditions. But BPH is still a problem because as the prostate enlarges, it squeezes the urethra. And when the urethra is compressed, urine can't flow freely. That's where all those symptoms come from. The weak stream, the hesitation before flow starts, the sensation that you haven't fully emptied, the urgency, the frequent nighttime trips to the bathroom. These aren't just inconveniences. Over time, incomplete bladder emptying can lead to urinary tract infections, bladder stones, and in serious cases, kidney damage. So when men come to me with these symptoms, we take them seriously. And yes, there are medications, there are procedures, there are surgical options when things have progressed significantly. But before we get there, and often alongside whatever treatment we're pursuing, I always talk to my patients about what they can do at home, right now, to support better urinary function naturally. And that brings me to the 30-second habit. It's called the pelvic floor contraction sequence. And before you click away thinking this is some obscure exercise routine, I want you to stay with me for a minute, because I've seen this make a real difference in men's lives. In my experience, this is one of the most underused tools in men's urological health, largely because there's a misconception that pelvic floor exercises are only for women. That is completely wrong. Men have a pelvic floor too. It's a group of muscles that form the base of your pelvis. These muscles support the bladder and bowel, regulate urinary flow, and play a direct role in how well you void. When these muscles are weak, uncoordinated, or chronically tense, which happens a lot in men with BPH, urinary symptoms get significantly worse. When you strengthen and properly coordinate them, the improvement can be remarkable. Here's how the 30-second habit works. Once in the morning and once at night, that's all I'm asking, you perform a brief, intentional pelvic floor sequence. It takes about 30 seconds each time. You can do it lying in bed before you get up or sitting quietly before you go to sleep. Here's the sequence. Contract the pelvic floor muscles. Think of the sensation of trying to stop urination midstream. Hold for 5 seconds, then fully and completely release for 5 seconds. That release phase is just as important as the contraction, maybe more so. Then repeat that 5 times. That's it, 30 seconds. Now I need to explain something important, because this is where most men go wrong even if they have heard of pelvic floor exercises. Many men, when they try this, only focus on the squeeze. They tighten everything and then just let go casually. But the deliberate, conscious release, holding that relaxed state for a full 5 seconds, is what retrains the muscle to fully open during urination. In men with BPH, the pelvic floor is often in a state of chronic tension. It's bracing around an already compressed urethra. Teaching that muscle to truly let go is what allows the flow to improve. In my experience, men who practice this consistently for 3 to 4 weeks report a noticeable difference in stream strength and the sense of complete emptying. Several studies support pelvic floor training in men with lower urinary tract symptoms, and what I find clinically is that results often come faster than men expect. But I don't want to stop there. because the 30-second habit is most powerful when it's part of a broader approach. And there are several other natural strategies I recommend alongside it. The first is something I call strategic fluid timing. Many men with urinary symptoms make the mistake of cutting back dramatically on fluids, thinking less water means fewer trips to the bathroom. This backfires. Concentrated urine irritates the bladder wall, which actually worsens urgency and frequency. What I recommend instead is to front-load your fluids. Drink most of your daily water intake. Aim for 6 to 8 glasses total in the morning and afternoon, and taper off after about 6 in the evening. This reduces nighttime trips without dehydrating you during the day. Small change, meaningful result. The second strategy involves diet, specifically reducing foods and drinks that are known to irritate the bladder and inflame prostate tissue. At the top of that list, caffeine and alcohol. I know, these are hard ones, but both caffeine and alcohol are diuretics, meaning they increase urine production. They also relax the internal urethral sphincter in ways that worsen urgency. I'm not telling you to eliminate your morning coffee forever. What I'm saying is, if you're waking up twice a night and starting your stream takes 30 seconds, it is worth trying a week without coffee and alcohol and seeing what happens. Many men are genuinely surprised by how much their symptoms improve. Also worth limiting: spicy foods, artificial sweeteners, and carbonated drinks. These are bladder irritants for a significant portion of men. What I advise instead is incorporating foods that are naturally supportive of prostate health. Tomatoes, particularly cooked tomatoes, think tomato sauce, tomato soup, are rich in lycopene, an antioxidant that multiple studies have linked to prostate health. Cruciferous vegetables like broccoli and cauliflower contain compounds that support healthy prostate cell turnover. Pumpkin seeds are a personal favorite recommendation of mine. They're high in zinc, which is concentrated in the prostate and plays a role in normal prostate function. A small handful a day is genuinely beneficial. The third strategy is movement. Sedentary behavior is one of the most underappreciated contributors to prostate problems. Sitting for long periods increases pelvic congestion, essentially blood and fluid pool in the pelvic region, which can worsen inflammation and BPH symptoms. I tell my patients to get up and move every 45 to 60 minutes if they have a desk job. A 5-minute walk is enough to get circulation going again. Regular moderate exercise, brisk walking, cycling, swimming, has been shown in multiple studies to reduce BPH symptoms over time. Exercise also helps manage body weight and excess body fat, particularly around the abdomen, elevates estrogen levels in men, which drives prostate growth. This is a real mechanism, and it's one of the reasons weight management matters so much for prostate health. The fourth strategy is one that surprises many of my patients: addressing stress. I know it sounds disconnected from urinary symptoms, but the pelvic floor holds tension. When you're chronically stressed, your sympathetic nervous system is activated. Your body is in a low-grade fight-or-flight state. That activates muscles throughout your body, including the pelvic floor. Men who are under significant stress often have tighter pelvic floors, which worsens obstruction around an already enlarged prostate. Deep diaphragmatic breathing, even just 5 minutes a day, genuinely helps. It activates the parasympathetic nervous system, encourages pelvic floor relaxation, and improves urinary flow in ways that are real and measurable. Now, I also want to address something that comes up often in my practice, and I think it needs to be said clearly. A lot of men ignore urinary symptoms for years. They tell themselves it's just aging. They don't want to make a fuss. They're embarrassed. And I understand that, I really do. But ignoring progressive urinary symptoms is a risk. What starts as a slightly weak stream can, over years, become incomplete emptying, which becomes recurrent infections, which becomes bladder dysfunction. The bladder is a muscle. When it works too hard for too long against an obstruction, it begins to lose its ability to contract properly. Once that happens, it's much harder to reverse. So please do not let embarrassment or "it's just aging" thinking stop you from paying attention to what your body is telling you. If you've been having urinary symptoms for more than a few months, get evaluated. A simple physical exam and a PSA blood test can give your doctor a great deal of information. These are not scary tests, they are empowering ones. What most people don't realize is that most men who get in front of these issues early, who make lifestyle changes, who stay consistent with pelvic floor training, who manage their diet and movement, do very well. They maintain strong urinary function well into their 70s and 80s. The men who struggle most are the ones who waited too long. I also want to briefly mention something about sleep, because it connects directly to one of the most frustrating symptoms of BPH, nocturia, which is the medical term for waking at night to urinate. Beyond the fluid timing strategy I mentioned earlier, sleep position can actually play a small but meaningful role. Sleeping on your side, particularly your left side, encourages better kidney filtration during the night, which can slightly reduce the urge to wake for urination. It sounds almost too simple, but in my clinical experience, men who make this shift often notice they wake once instead of twice, or twice instead of 3 times. Combined with limiting fluids after 6 p.m. and doing your pelvic floor sequence before bed, this can have a real impact on sleep quality. And sleep matters enormously here, because poor sleep raises cortisol, lowers testosterone, increases inflammation, and worsens every symptom we've discussed today. Everything is connected. I want to leave you with this thought. The prostate, the bladder, the pelvic floor, these are not things most men think about until something goes wrong. But the men who age with the most vitality, the most comfort, the most confidence, those are the men who decided at some point to pay attention, to make small, consistent choices, to take a 30-second moment morning and night to reconnect with their body. You don't need to overhaul your life. You need to start with one habit. The 30-second pelvic floor contraction sequence I described today, try it for 2 weeks. Just 2 weeks. Be consistent. Pair it with better fluid timing, cut back on the caffeine and alcohol temporarily, add some pumpkin seeds and tomatoes to your diet, and go for a 20-minute walk most days. See how you feel. I am confident you will notice a difference. And if you do, I want to hear about it. If this video gave you something useful, please subscribe to this channel. Every week I bring you evidence-based, practical health information designed specifically for men. No fluff, no scare tactics, just real guidance from a real physician who wants to see you thrive. Share this video with someone who needs it. Leave a comment below telling me which tip you're going to try first. I read them, and I appreciate them more than you know. Your health is worth the 30 seconds. I'll see you in the next video.